I want to take you deeply into an area that we think is fundamentally important to this movement, and that is the digitalization, the digital modernization of CMS. It was initiated with an RFI that we put out, one of the first requests for information that we put out by Amy Gleason. I'd like Amy to come join us. She's strategic advisor and the acting administrator of US DOGE. With her, Brian Anderson, a physician, CEO of Coalition for Health AI, or CHAI, making their way out. Sue Sheridan is the CEO of Patients for Patient Safety. And finally, Sumit Rana is the president of Epic Systems. They're all joining for, I'm hoping to be an honest and maybe hard-hitting, we'll find out. Sue, what kind of barriers exist for patients, and how will the digitalization shift that? Or is this a false promise?
Oh, I think that, some of the barriers that face us, and like Amy, I am a mom of a young man who has complex healthcare issues as well. And, some of the barriers especially are the interoperability. I mean, that is, my son manages 8 or 9 different portals. They don't speak to each other, and that really is a patient safety issue, because at times, when the systems can't speak, Cal, my son, just had a medication error that, we fixed through digital health because, a doctor asked him to stop taking a medication, a seizure medication. Cal called me, I was here in DC. I went to ChatGPT and it says, do not go off this cold turkey. I called my husband, he went on to open evidence. He said, do not go off this. My son went on to his portal, Epic. He was communicating with his Epic doctor, but his other doctor was on a different portal. So that doctor had no idea what was going on, that my son could not go off this. So I think interoperability is a huge barrier. Another barrier is access to something like open evidence, which doctors have access to. Why can't I have access to that? Why can't I have access to the same information that the doctors have? We have to democratize information for our safety.
Sue, do patients trust AI? I mentioned earlier that we want to give patients the right to opt out. How many will opt out of a system that is using AI or more sophisticated information technology tools to adjudicate what you should know about your medical record?
Well, that's a good question. I was just talking backstage about a report that came out just a couple weeks ago. It was an international study on patients, and of the 15,000, I think it was, patients, half of them were supportive of AI. Now, there are different demographics. I think what will get us to trust AI even more is if we're engaged as partners in the development, the oversight, the governance of AI. We want transparency, we want privacy, we want to make sure this is safe. So that's something that we hope that CMS, if they are paying for interventions that include AI, that it undergoes rigorous studies to ensure that we're not guinea pigs.
If you're trying to think about the average beneficiary, what do they want to hear from government about? What do they want to hear from private vendors who are making apps let's say they're a 75-year-old diabetic female who still has her husband around. So she's managing herself and him most likely, and other family, but her diabetes and herself. What does that look like? What would you want that to look like a year from now?
Well, I would have to put it in the position of like managing my son. He's a dual at Medicare and Medicaid. And so there is a total disconnect right now between us and Medicare and Medicaid. I mean, I would like it to be bi-directional, quite frankly, not just to hear from Medicare, Medicaid, or Medicare, but I would like you to hear from me as well. And so, like, to hear from you, I would like to hear things like, how do I manage, 9 different portals? How do I manage medication management? How do I make Medicare aware when things don't go right? I mean, I think one of the biggest concerns I have in our healthcare systems is misdiagnoses. Misdiagnosis harms or kills 800,000 Americans a year at a cost of about $800 billion, according to the OECD. So I want you to hear from me about that, but I also want you to help me prevent those diagnostic errors, equip me with information, equip me with AI, equip me with the autonomy and the agency that we all need. Make me aware of those digital tools, help me pay for those digital tools. And so I think that what I would like to see is this bi-directional between Medicare and the beneficiaries, because we rely on Medicare so heavily.
Yeah. And are you okay with it being text form? Would you prefer video, chatbots, avatars, or does it not matter?
Yeah, I think it would matter per patient. So I think you're going to have to offer all of the above. Like, for example, my son is speech impaired, so he would want to do it via text or something very high tech. Matter of fact, he uses AI to speak. So we need to think about our patients out there that have speech impairments. Let's give them AI to speak. My son uses Murph AI with his clinician. So we have to really think big about, how we're going to communicate. And, my 92-year-old mom would want to communicate in a different way than, my 30-year-old, very tech-savvy son.
Act four. Sue, you would say something?
Yeah, I just talking about fraud and waste, from a little different perspective. I mean, charging Medicare for care that caused harm is fraud.
Yeah.
And we know that in the United States, a very small percentage, maybe 5% of harm gets reported.
Yeah.
So think about, fraud is really a patient safety issue, because when we don't know about that harm is hidden. We need to see that harm.
Yeah.
And so we are paying for billions of dollars of care that has harmed patients. So I think we can reframe thinking about fraud and waste as a patient safety issue. We're not learning from it, and we're paying for it. Matter of fact, for my son who was harmed, guess who's paying for it? CMS, the state of Idaho, and I am.
Yep. Yeah, excellent point. And that would be really helpful if we can get that message out today.
I'd also add that I think when we do get to this digital identity standard, having providers use that for the provider directory also validates their identity. And if you start to use that, it'll catch fraud that way. And then giving patients the ability to report fraud through our tools that we're building is another way. In my other hat and Doge side, I have gotten thousands of letters from patients saying, I think this is Medicare fraud.
Yeah.
If we give them a digital way to do that that's easier, I think can catch
That's
a lot
that
of
bi-directionality where
Exactly.
patients really want to teach our healthcare system when things go wrong.
Yep.
There's no place for us to go with that data, and we actually need to open that up for patients to report harm events so we can learn from that.
Yeah, 100%.